Hello, my name is Dr. Antonia Pieracci, and I'm a clinical psychologist at the American Institute for Cognitive Therapy. In this podcast, I will provide you with information on depression, what it is, what causes it, and what you can do about it. First, let me ask you a few questions. Do you feel down or sad much of the time? Is it hard to get out of bed? Do you find that you don't enjoy things the way that you used to? Is it difficult to concentrate or to make decisions? Do you have trouble sleeping? Do you feel tearful much of the time or get easily irritated? Have you withdrawn from friends and family because of the way you feel? Is your mood interfering with your ability to concentrate at work or school? Have you thought about harming yourself? If the answer to any of these questions is yes, then you may be depressed. Let's begin with the definition of depression. Depression is not just having a couple bad days or being a pessimistic person. Some fluctuations in mood are a normal part of human existence. Depression is also not being lazy or unmotivated, as some people who are depressed have been told by others. Depression is a serious medical condition that requires treatment, just as a broken bone or an infection requires medical attention. A clinical depression exists when, for at least 2 weeks, most every day, you feel down and have a number of other symptoms, such as those mentioned above, that negatively affect your life. For the depressed person, these problems interfere in their life in some way, either in their personal life, at home, at work, or at school. Some people who are depressed are able to function in their life, go to work, take care of their children, or do their schoolwork, although they must make a great effort to do these routine activities and they feel rotten. However, for other people, depression can be so debilitating that they find it difficult to even get out of bed and to continue to care for themselves in basic ways. This shows that two people who are depressed may experience their depressions quite differently. In children, depression may be manifest in a slightly different way than in adults. Children who are depressed may experience irritability, bodily aches and pains, and social withdrawal. Depression is actually quite common. In fact, a prominent psychiatrist once referred to depression as the common cold of the psychiatric illnesses. Between 10 and 25% of women will become depressed over the course of their lifetime, and between 5 and 12% of men will become depressed at one point in their life. People between 18 and 25 years old are the most likely to get depressed, whereas people older than 65 are the least likely to get depressed. Depression can happen to anyone. There is no link to race or ethnic background, education level, income, or marital status. An untreated depression can last 4 months or longer. People generally recover completely from an episode of depression and return to their lives as usual. However, for a small group of people, depression can last for months or even years. For those who do recover, the bad news is that 60% of them will have a recurrence of depression at a later point in life. So given that once someone experiences one episode of depression, they are likely to get depressed again, it is important to get help. This way, if the depression returns, the person has the tools to manage it and stop it from taking over her life. Another reason to get help is that depression can be a devastating illness. Up to 15% of depressed people die by suicide, and for others, depression can lead to loss of job, family, and financial resources. Some people use drugs or alcohol to try to make themselves feel better, which can then lead to other problems such as addiction. Depression is called an episodic disorder because it generally occurs in discrete blocks of time. In this respect, depression could be compared to a flu, which comes on for a period of time and then goes away completely. This is compared to other conditions that are chronic and tend to always be present, such as diabetes, which requires constant attention. There is another type of depression called dysthymia, which is more chronic in nature. However, dysthymia is different in that it lasts longer and is not as severe as depression. Approximately 6% of people will experience dysthymia over the course of their life. Finally, there's one more type of depression it's important to mention here. Some people with depression experience mood swings, where their mood alternates between feeling down or depressed, as I've described already, and feeling very up. In the up mood, these people sleep very little, are productive, energetic, and talkative, and may engage in risky behaviors such as reckless driving, shopping sprees, or unprotected sex. People who experience these symptoms likely have what used to be called manic depression and is now called bipolar disorder. For the rest of this podcast, I will be talking about clinical depression, which will refer to both major depression and dysthymia. For more information on bipolar disorder, you can visit our website at www.cognitivetherapinyc.com. Okay, so now that you know what depression is, you may be wondering what causes it. Depression is caused by both genetic and environmental factors. Some people have a tendency to get depressed, which is hardwired into their genes. Many people who struggle with depression also have family members who are or have been depressed. We also know that certain life events can cause people to become depressed. This is the environmental part. We know that situations such as natural disasters, a history of abuse, death of a loved one, divorce, and being fired can result in someone becoming depressed. What's interesting, however, is that not everyone who experiences these life events will become depressed. For example, not everyone whose apartment burns down will get depressed. Not everyone who lost someone in 9/11 became depressed. Those people who did become depressed in these situations may have a biological makeup that predisposes them to depression, or they may not have developed the coping skills to manage whatever difficulty has befallen them. So you may be asking yourself, what if depression is in my genes? Well, there's good news. No matter what the cause, there are ways that you can get help. In fact, research has shown that there are two very effective ways to treat depression. One is through cognitive behavioral therapy, and the other is through medication.